Everybody again for being here. And Dr. Davila, please, if you can start sharing your screen.
Great. And can I just confirm that you guys are able to see that? Okay, wonderful. Thank you so much. Thank you so much, Paula, for the invitation and the opportunity to be here with all of you today. And so, as Paula said, we're here to talk about healthcare choices, planning for your care now and in the future. And so really, I think the first place to start is just talking about patient-clinician communication. The reality is patient-clinician communication is so important for all patients, as that's what helps individuals understand what's going on with their health and helps their clinicians understand what matters most to the individual so that they can together develop care plans that support those priorities. In some research I conducted with a wonderful organization called the Massachusetts Coalition for Serious Illness Care, we found that in order for communication to be successful, there needs to be a trusting relationship between the individual and the clinician. Knowing a clinician for a long time or having a long-standing relationship can help, but we've also spoken to folks who shared that they're open to communicating with people who really treat them with respect and truly listen, as that helps them feel heard and understood and really treated like a person, not a number, which was a theme of this research. It's feeling heard, listened to, and respected that can create these micro trust building moments between individuals and their clinicians. And while at the core, it's really important for everybody, it's especially true for individuals who have previously faced challenges like discrimination and racism, have experienced poor listening before, and really just had a harder time accessing the care and the supports that they need. The reality is that how people have been heard and listened to before will very likely influence how much they want to or feel safe to speak up now and in the future. And so planning for your care is really important at all stages of health. Here, I want to briefly introduce you to the concept of the care planning umbrella. We seem to like umbrella metaphors in this world, and so you may see a few of these examples. But the care planning umbrella includes really talking to individuals, patients about what matters to them, their goals and values and priorities. And this matters across the entire continuum of care. You can see here from kind of healthy adults or individuals with chronic illness to individuals who have a more serious illness. And then as they progress in their journey, who might be closer to end of life care. So for example, there are decisions that are important to make with an individual who has a chronic illness like diabetes. For example, they may ask themselves, will this diabetes medication help me get the quality of care that I want? By comparison, an individual in the serious illness bucket, these are just some sample decisions, might ask themselves, you know, if there's an individual who has cancer, will this chemotherapy help me get the quality of life that I want? Or lastly, an individual who finds themselves more in the closer to the end of life bucket, who maybe has end stage cancer, for example, might say, will this procedure help me get the quality of life that I want? And so the reality is that there are decisions that happen at all stages, and having really clear communication between individuals and their clinicians can help you together make better decisions. And so just starting, I'll go through some of this quickly, but just reminding ourselves, you know, this is the Alzheimer's disease research group, just saying, okay, let's just start at the big picture. Dementia itself is an umbrella term for the loss of memory and other thinking abilities that become severe enough to really start interfering with daily life. The most common type of dementia is Alzheimer's dementia. We believe it represents between 60 and 80% of individuals who have dementia, and that there are other less common types but still occur. And so, for example, there's Lewy body dementia, vascular dementia, and there might be some individuals who have other neurologic diseases like Parkinson's disease, who may also have dementia as a component of that disease. And importantly, here at the bottom, there's also individuals who have mixed dementia, who really have dementia from more than one type or more than one cause. Ultimately, dementia is a fatal disease, but many older patients actually die with a dementia diagnosis and not necessarily from their dementia diagnosis specifically. And so we can think of dementia as having different stages. For example, in early stage dementia, individuals may start to have trouble managing their finances, or forgetting recent events or names, or may start to encounter some difficulty remembering to take their medications, or remembering if they took their medications already, for example. They may start to have difficulty recognizing acquaintances. Then, as we move forward to a more middle stage of dementia, they start needing a little bit of extra help with things. So, for example, needing help with more complex chores or engaging in their hobbies that they did before. They may start to get lost or unfamiliar, even in places that are familiar to them. I think oftentimes this creates a sense of confusion in the individual with dementia, and they can feel frustrated with themselves and may have some periods of irritability or agitation, for example, because they can sense that something's not right, but they can't quite pinpoint what it is or really fully appreciate what's happening. And this experience can be really frustrating. At this middle stage, they may even have difficulty recognizing some family members, particularly if they're family members that maybe they see every so often, or maybe at holidays or less frequently. And then finally, in the late stages of dementia, we start to see individuals start to have problems, for example, with much more basic things like swallowing and eating problems. They may need even more help or have really lost the ability to walk, bathe, dress themselves, or use the toilet independently. With time, as dementia gets more advanced in the late stage, their ability to communicate becomes harder and harder and diminishes. And for some individuals, they may even have minimal verbal communication. Another common feature of late stage dementia is an individual can start to experience recurrent infections. For example, sometimes if their swallowing is more challenging, they may start to have, they may unintentionally either swallow some saliva or swallow some food down the wrong pipe and develop an infection in the lungs, like a pneumonia. Or another common type of infection that they may experience is something like a urinary tract infection. And so, unfortunately, often in very late stage dementia, recurrent infections can become a common theme. We also know that dementia carries a really large burden. There are many financial and emotional costs to patients, families, and caregivers. For many individuals, particularly as the dementia becomes more advanced, over 90% have a family caregiver. And most of this caregiving support, but certainly not all, much of it comes from women in the family, be they family members, close friends, or others. Caregiving for an individual with dementia can be a real burden unto itself. And in certain studies, they've measured that anywhere from 20 to 40%. So that's really 1 or 2 out of every 5 caregivers that report depression. We have also seen that caregivers who report having emotional strain, which it's only natural to have emotional strain taking care of an individual with dementia, even actually have a 1.5-fold increased risk of death themselves, because it takes not only a physical, but a mental and emotional toll on the caregiver as well. The reality is that dementia is a long and slowly progressive disease. And in many ways, caregiving can become potentially harder over time as the individual has a growing and growing number of care needs. That can lead to a loss of work, a loss of the family network and social supports that have previously been helpful. It can lead to a deterioration of health and savings, again, not only for the individual, but oftentimes their family and caregiver support. And what can happen sometimes is even for the individual, they may have untreated physical symptoms or experience burdensome interventions. What might not be so hard for myself or another individual to say, hey, let's go to the doctor's appointment. That may be a really big challenge for a caregiver. Taking an individual with dementia to a doctor's visit can really be a whole day's outing to make it happen. And so what kind of supports are available? As Paula mentioned, I'm a palliative care physician, and many people ask me, what is palliative care? So just to share with you, palliative care is specialized medical care for people living with a serious illness. It's really focused on providing relief from the symptoms and the stress of illness. And the goal is to improve quality of life for both the patient and the family or caregivers or care partners of that individual. Palliative care itself is provided by a specially trained team of doctors, nurses, and other specialists who often work together with the patient's own doctors to provide an extra layer of support. Palliative care is based on the needs of the patient, not necessarily on the patient's prognosis. It can be appropriate at any age and at any stage in a serious illness, and it can be provided along with curative treatment. And so next, I want to show you this diagram. And this can be a little bit confusing, but I'll walk you through it. And so this first phase is really an individual who, we would consider a healthy adult who practices kind of preventative health. Now, for some individuals, at some point, they may receive a diagnosis of a chronic life-limiting illness, for example, like dementia. Now, there are certain medications that can be tried, and thankfully, research is always growing about potentially new medications that can be helpful that try to provide kind of curative care. Now, in the dementia world, unfortunately, the reality is there's no specific cure, but there are some treatments that can try to manage the progression of dementia. But palliative care can really start early. It can be working alongside it. And these little blips that we see, those may represent, for example, blips or infections or something that happens that really sets an individual back. And they can get better, but you can slowly see they're progressing. And maybe as their dementia is progressing, there may be more and more of a role for palliative care over time, and perhaps less and less a role for some curative treatments. And then there reaches a point in time where really there's no longer, unfortunately, a role for curative care. And in the doctor's best guess is that that individual may have about 6 months or less to live. And this is the role in this green sliver here, is where hospice may be helpful. And then what happens is after a patient has passed or has died, then the caregivers and family still continue to have a bereavement or a grieving process. Just because the patient has died does not necessarily mean that the whole family unit who's been supporting them it's suddenly the light turns off. So where is palliative care provided? Most commonly, particularly for individuals with dementia, the most common place that they might interface with palliative care is in the hospital setting, sometimes for individuals who might be hospitalized with an infection or some other issue. Less common care settings, but importantly growing, which is exciting over time, is it can be provided in the home setting, in outpatient clinics, or for some individuals with dementia who are cared for or live in nursing homes, it can also be provided there as well. Another common question I often get asked is, what is the difference between palliative care and hospice care? There are some important, as we can see here in this center, there are some important shared goals between palliative care and hospice, but they help people at different phases of the illness, of health and illness. So looking at this center with what they do share in common, they're both very much intended to help provide symptom relief, reduce stress, and to provide some physical and psychosocial relief, really focused on the individual's comfort. Focusing on the blue here, palliative care on the left, strives to achieve these goals for individuals at any stage of disease, often alongside curative treatment. It typically takes place in the healthcare setting, as I mentioned, like a doctor's office or a hospital. By contrast, on the right-hand side in hospice care is reserved for individuals who are closer to the final stages of their life, where the doctor or clinician's best guess is that their prognosis is approximately 6 months or less of life. My emphasis here is really best guess. So if you've followed the news at all in the last year, we know that former President Jimmy Carter was enrolled in hospice over a year ago and continues to be cared for on hospice. So this can absolutely happen. But the key is that the doctor's best guess with what they know is that their best guess is that the prognosis is about 6 months or less. When someone is on hospice, they've typically chosen this fully comfort-focused approach that does no longer includes curative treatment for their illness if it exists. It often occurs either in the patient's home or in a facility. It does importantly often rely on family caregivers, particularly in the home setting. Now, me personally, as a palliative care doctor, I'm trained in both palliative care and hospice. And what I tell my patients is that hospice care is one small part of what I do under the bigger umbrella of palliative care. Now, I want to switch gears a little bit and share about some of the work that we do at Massachusetts General Hospital to support communication work. The MGH Continuum Project was founded in 2016 to really help support the communication needs of individuals with serious illness. Now, under the leadership of our new medical director, Dr. Elizabeth Lindenberger, who joined us early last year, we had an opportunity to reflect and reimagine the Continuum Project's vision and mission. And so our vision is that we envision a healthcare system in which all people across the continuum of age and illness receive care that focuses on what matters most to them, enhances well-being, and fosters respect and belonging. And our mission is really to elevate patient voices by improving communication and care planning between clinical teams, patients, and caregivers. And so just to introduce you, this is our incredible Continuum Project core team, comprised of individuals from multiple professions. For example, here we have not only doctors, nurses, nurse practitioners, we have physical therapists, we have nursing administrative leads, we have pediatricians, as well as data analysts, specialists, and administrative support to help us in the work that we do. And these are importantly not only palliative care trained clinicians, but also primary care clinicians. And the broader Continuum team also includes champions from many different areas of our healthcare system. One of the important pillars of the Continuum Project is really focusing on promoting equity through patient engagement. And this is really patient and care partner engagement. And so an important thing that we strive to do is reach patients and families, as well as reach diverse communities. This includes having patient-facing educational materials on the Continuum website, which I've included here. It's mghcontinuumproject.org. And so this includes some materials like talking to those important people in your life who support you and talking to clinicians. So we have some guides here, like you can see on the right-hand side, about living and aging well, 4 steps that you can take to talk with the important people in your life about the future of your health and how you're coping with your health now, and can even give you some starting language that you can use. So there are some tools available through our website to try to make it easy. And I think you'll sense that with both what I'm sharing and what Ellen's sharing is there's many tools that exist. So even if you say, I'm not sure if this is the exact tool for me, we want you to know that there are other options, and hopefully you can find one that really resonates or that you find most helpful for you and your family or the individuals that are important to you. And so, for example, I'll share here another important tool and resource that's available is a program called Prepare for Your Care. And so Prepare for Your Care, it can be found at prepareforyourcare.org. And it's a website that is designed for patients and family members or care partners to access and really walks an individual through 5 steps. Things like choosing a medical decision maker, deciding what matters most, choosing the flexibility for your decision maker, and really telling and sharing with others your wishes after you've had some time to reflect yourself. And then another step of making sure that you know how to ask your doctors the right questions. And so you don't have to do all of the steps at once. This is definitely a website that you can leave and return to, and you can choose what steps are right for you. And what the website has is it offers you some information. So for example, in that first step, choosing a medical decision maker, it offers some information about, see why choosing a decision maker can help your family members or friends. And it normalizes that some people are ready to choose for a medical decision maker and some people are not yet, and both are okay. It has videos that walks you through sample patients or sample scenarios that, as I've shared this tool with other patients, they find, oh, wow, that does sound like me, or maybe that doesn't quite sound like me, but this other video sounds like me. And importantly, this website is fully available in English and in Spanish. So the videos are also available in Spanish as well. And so it has sections around, for example, how to practice asking your doctors or the clinicians who are helping care for you the right questions, and walking through how individuals might do so as you reflect and think about, how does this make sense for me? And so just to share, I think a few key takeaways from this section is palliative care and hospice services really can be resources along an individual's health and illness journey. Second, really, there are many resources available to help support you in talking with the important people in your life and talking with clinicians, including some that are available through the Continuum Project at MGH. And lastly, Prepare for Your Care is one easy to access online resource to support patients and care partners in planning for the future. So I hope I've shared with this why it's really important to start thinking and planning, and to remember that it's never too early to start planning for your health.
Thank you so much, Dr. Davila. Ellen, do you mind sharing your screen now? Thank you.
All right, terrific. Can everybody see that screen? I'm just going to pick up and hopefully really add to that wonderful presentation about care throughout your lifetime. We are certainly on the exact same page here in terms of how to do this in a way that is right for you. We're very consumer oriented at Honoring Choices Massachusetts, and I'll tell you more about that. So this presentation is actually for both consumers and for the care providers who are on this call too. I'm Ellen DiPaola, and I'm the president of Honoring Choices Massachusetts. And for the last 11 years now, we've run this very collaborative organization here, and it's really about your healthcare and your choice. As you heard, I come to this not through the medical world, but through the legal world. I was a guardianship attorney for quite some time, and it just became very obvious to me that people didn't really even have the first sense that they have a right to control their healthcare decisions. They can make those decisions. And as Dr. Davila was saying, it's really find care that's right for them in working in partnership with their care providers. So what we do at Honoring Choices is to try to refocus on the person themselves and say, you can start to make your own personal care plan. And then really share that plan with your care providers for better care today, right now, and over your lifetime. So those are the tools we have to share. We talk to consumers every day, a lot lately in webinars and virtual. And what we say is the same thing to providers as we say to consumers, that everybody's on this healthcare journey, right? And the idea is to get the best possible care. It's what we all want. Whether we're promoting everyday wellness, which we do right through our lifetime, we're managing those health needs and chronic illnesses, or we're living with serious illness, so planning for making sure we have good end-of-life care. That's the journey, and everybody's journey just needs a plan. And that's what we try to help people with, this idea that, your plan is about you and what's right for you, but and how you talk to important people around you, including family and caregivers, how you work in partnership with your providers to get that care. That's the roadmap that we're looking at, very similar to what Dr. Davila was talking about. But we really like to say to consumers, making a plan, it really helps everybody. This idea that illness and accidents, they're just part of life. They happen from when we're considered adults, 18 and on, right? So making a plan really protects people. And that's how I look at a lot of these documents. We have a right to talk about what we want for care and to make those plans. But when we're not able to do that, the healthcare planning documents really speak for us. And can protect our rights. And we think we're starting to really see it being able to minimize racism, discrimination, unnecessary suffering for people, just to have those plans. We know how much it supports family, who for years I worked at the bedside as a guardianship attorney, and how important it was for families to have those documents in their hands when their loved ones couldn't speak to them, to hear their voice, to see their handwriting, to know what they wanted. And we know how much these plans really help our care providers, as Dr. Davila was just talking about. So we have a program here called Who's Your Agent? And it's a structured approach, a step-by-step approach to making your own plan. And it is used both with consumers and care providers. So our website has everything is free and downloadable. Everything we talk about today is right there. And then we also have thousands of healthcare providers and organizations as partners. And they take our tools and they work with you in the community, and they help to start these conversations and get you the care that you need. So very simply, it breaks down into 2 toolkits here. Everyone can start with a getting started toolkit. And that's part of what's been so successful about the work, is that it's so important to talk about care when we're ill and at the end of life, but it's also really important to start early and to see if we can help people in our family and our communities think about doing this now as early as 18, to really start to build those trust and to build those conversations to get good care. So one of the reasons we named it the Who's Your Agent program is because we start right at Massachusetts law, which says you can direct your own healthcare choices. Doesn't mean we can get all the care we want, or that it's all paid for, or it's in our community, but you have a right to choose that. And one of the first ways to start making your own plan is to choose a healthcare agent, if that's possible. And the law actually makes this really easy. It says that the trusted person you choose is actually called your agent. And that the legal document where you appoint your agent is called a proxy. And I just point that out because we have found that most of our consumers don't know they have that right. It helps to get started in making your own plan. So in this program, which is on our website and fully easy to use, everyone can start with this Getting Started toolkit. We hope it's as easy as 1, 2, 3. We've been working with Consumer Voices for 10 years now to help keep making this easier to do. But the one is always, can you choose a healthcare agent? And if you can, that's this wonderfully protective document when you're not able to speak for yourself, you have an advocate, a person you trust, who can come in at any point in time and help talk to your doctors and get you good care. And you appoint that person in a proxy. Now, I just want to say, and we'll talk more about this, we know now about 1/3 of the folks in Massachusetts are just not able to choose an agent for so many reasons. And that's why that step 2 is there, because if you can't choose an agent, you can always start with this personal directive. And that is a document we made up here. It's sometimes called a living will in Massachusetts. Confusing language. But the idea is these are my choices. These are my instructions. Here's what I want you to know about me and what matters to me. And that gets written down in this personal document. So if you can choose an agent, great. That personal directive becomes their instructions for how to take care of you. And if you can't choose an agent, you just start with step 2 and that personal directive. And that's how that toolkit has been working really well to be inclusive of everybody, every age, every community across the state. And that 3rd step is the really important one. Then now that we have this plan, let's go and put it into action and talk with our care providers. Because, it's one thing to have documents, but that's not the point, right? The point is to make sure you're having good conversations, building that trust with folks to make sure you're getting the care you would want. So really simply, I'm just going to go through this quickly. Even for those of you who might have a healthcare proxy already, it might help to know some of this for people around you. But this is all on our website. We have a short video that goes through this as well. But in choosing an agent, you simply choose a person you trust to be your agent. And if you're not able to do that, that's okay. And that's what we tell people. You just start with the personal directive. The idea is to talk to your agent about the care you want. Most people we find have a sense of, what worries them, what they want, what they don't want, even in general terms. So if they get sick and we have a medical emergency, that agent can step in and help. And what's really important in Massachusetts is that we appoint that person. We write that person's name down in a healthcare proxy. I'm going to show you that document in just a minute. Why do we do this? It is such a blessing to be able to have an advocate. Not everybody can do that, but someone who can step in for you when you're not able to make decisions, even if it's just for a short while, even if you're just sick and you're going to recover. That happens a lot, when you're 18 and up, and to make sure in our world of medical care, that person can work directly with a clinician to get people good care. The one thing I just want to remind you, this state has very particular laws. And that's why we really like when people try to use Massachusetts documents so that they can feel really sure about things are going to be valid and honored. So in this state, your spouse or your family member, somebody close to you, does not automatically have the legal power to make decisions for you unless their name is in that healthcare proxy. So yes, our doctors will talk to us and say, here's our plan for our loved one. Let's all move forward. But what we find sometimes, if there isn't an appointed agent, like a quarterback for your family team, and their name isn't in that healthcare proxy, families can have a lot of different ideas about what care should look like. And that makes it hard to get people good care. So that's why that proxy is so important. It not only protects you, but as one gentleman said to me that, he had this wonderful, big, loud family, and they needed to appoint one person as that quarterback to be there to lead the way. So here's the healthcare proxy. It's on our website. It's in 15 languages. Happy to keep translating if you are either in communities or you're working with folks in different communities and you don't see a language there, let me know. It's really simple. I'm going to go through it quickly for you because, again, the people don't understand. You don't need a lawyer to do this. You don't even need to do this with your doctor. You can do this with yourself and a few witnesses. That's the trick to this, is you just need 2 people standing with you to act as witnesses as you sign this. So on half of the healthcare proxy, all you do is fill in your name and address. You fill in the name, address, and phone numbers of the person you choose to be your agent. And then if you can, you pick an alternate healthcare agent, a backup person. In case that healthcare agent can't be reached or for some reason can't do the job, that alternate agent then steps up and can help. But for a lot of people we know in talking to consumers now for many years, it's hard to pick a second person. So it's okay. You can leave that blank for now. So you pick an agent, and then just looking at the proxy, we made this really simple so people can do this quickly. All you're really saying in number 4 is, I give my healthcare agent the same authority I have to make any and all healthcare decisions, including end-of-life care and life-sustaining treatment decisions. Now, if there's something you want to limit, then you can write that in there and say, here's what I don't want my agent to do. But otherwise, you just leave it blank. And then you just do this final part. Again, this is the part we want to prepare ahead for. Before you sign it and date it, you have to have 2 people standing with you to act as witnesses. Anybody who's 18 and above, all a witness is doing is watching you sign the form. Then you give the pen to witness 1, they sign. They give the pen to witness 2, they sign, and you have a valid healthcare proxy. Now, here's the thing to know, that the witnesses, as I say, can be anyone. It just can't be the same person you chose to be your agent or your healthcare, your healthcare agent or your alternative agent. So they can't do both jobs. You can't be a witness and an agent at the same time. So your agent doesn't even have to be here to do this document, and they can sign later if they want in number 7. We have found this is optional in Massachusetts, but our healthcare providers seem to really like to know that we've talked to our agents and they've accepted the job, but that's optional. But you can see how quickly this can be done. It's a 5-minute document that has so much protection as we move forward with our healthcare. So again, sorry, I'm trying to change the slide here. There it is. It's on the website. We also have in the Getting Started Toolkit this little wallet card, which people seem to really like these days. It's something you can make and fill out yourself. You just download a piece of paper from your printer. It'll look like that. It'll come out like that big rectangle. And then you'll have instructions to cut out the rectangle and fold the card. And the instructions will show you how to fold it in 3. But you can see in that middle space, what you're doing, that's where you're putting in the name of your agent, your alternate agent, and those contact numbers. And then this goes right in your wallet. My son is a critical care nurse who works for Boston MedFlight, so he moves around a lot. And they sometimes find people who get into trouble. They fall, they get hurt, they're in car accidents, and they're moved quickly to the hospital without really knowing who they are or where their family is. So my son has told me a couple times that, to identify people, they'll look in a wallet or a pocketbook, and he's found the card several times. And that has really helped them get right to the healthcare agent. And for this one gentleman recently who had hurt himself, they called his daughter, who was his healthcare agent, and she was so grateful to be able to have that connection and get to the hospital with him. So that card is right there for you or for anyone who has a proxy. Now, what happens if you're not able to choose an agent? Again, about 1/3 of the people cannot hear. Either we get to the point where we just don't have anybody we know. For many people with illness like a dementia, it is possible that the dementia has advanced enough so that people don't have that ability to make decisions. Now that's a medical decision that we have to check with our doctors on. Do people have that ability still to pick someone? It's a pretty low bar. But for folks who've gotten past that, we don't just go and take everybody's rights away from them in the state. We say simply, you can't pick an agent. That's okay, no problem. The most important thing is that we know what you want for care, and you still have a right to make lots of different decisions. You may have lost the ability to make some, but typically people still retain things, and that's what we want to know. So that's when we get to step 2 in the Getting Started Toolkit. And again, even if you've done your healthcare proxy, this is something we'd love for you to look at and consider. And this is about that personal directive. It's really simple. It's like writing a personal letter to someone about what you want for care. And it can include not only medical things, but personal things that you want people to know and how to care for you. So if you have an agent, great. This document becomes the instructions for the agent. If you don't have a healthcare agent, that's okay. This is where you start. And in this space, we're just thinking about what's important to you. your values, your family traditions, your beliefs. Usually people have some idea of the care they want and they don't want. We have a history of care, and we know what works and doesn't. And then if we can, we talk to the agent or people who are important to you about what these decisions are. And as I said, this document's been really helpful to folks to not only give the medical choices, but to say, you know what, if I get sick, can Sally come and take care of my animals in the house so that I can get to care? There's a lot in this document. You can make it your own, and it really works well across cultures, across races, across ages and abilities, to make it personal. So you write down what you want, and you give a copy to your agent if you have one, and if you don't, what's been useful is it's your choice, but you can give it right to your healthcare provider, like a primary care doctor, and say, let's talk about this. And that starts a wonderful conversation about working together to get good care. So that's in our step 2. This is what it looks like. You'll see it in the Getting Started Toolkit. Again, you just download the kit from the website, or you can download just a single personal directive too. It's in 5 languages, I believe. And page 1 just really talks about those preferences, your thoughts, your beliefs, things you want people to know. There's a little section to say, if I get sick, here's the people I'd like you to call. And that certainly people have written down ministers and lay spiritual leaders, the neighbor across the street. It just helps people feel much more in control about what happens in emergencies. The second page has more choices about your medical care. This is a space you can even tell people about your medical care. People have attached their medication lists. Some people do that. Again, it's very personal, this thing. But you can also give those messages about what you want. Since this is a personal document, all you got to do is sign it and date it. There are no witnesses, no notaries needed here. But we find the healthcare proxy and the personal directive really work very well together. You're giving people a whole lot of information about you. And then in that third step in that Getting Started Toolkit, it's just, sometimes I think we just weren't taught this step. But now it's great that you've thought about what you want, you've written some of it down, but now we need to go put that plan into action. And that happens with our care providers. Having these early and trusted conversations, really building on those conversations, sharing the documents and saying, here, please put this in my medical record. That's been a great conversation piece to check that too. Once it's in your medical record, you can always check it and say, hey, my healthcare is changing a little bit. Some of my choices are changing. Can we look at those documents again? And to be able to get me good care today. And so that's what the plan is about, is how to work together for care right now and over your lifetime. What we're finding, our consumers are talking to a lot of us about, is how the documents have helped them have everyday conversations, like, how am I feeling today? What are the goals I have today to stay healthy? Do I want to get to a ball game next week? Is there a family reunion coming up? What do I need to get there? That's a goal. So we can talk about that. And the documents and the conversations are helping that happen. And the biggest question we find after how am I doing today is, what's ahead for me? What information do you need to be able to make decisions about your care? And those are great conversations to have with your providers. The last thing in the Getting Started Toolkit is we have consumer guides, which is how to start a simple conversation. Sometimes it's just hard to know what to say, and when you're in a doctor's appointment, sometimes it's a rushed thing. Sometimes you have specific questions you want to ask. We have found that these guides can be helpful just to ask even that first question. I'd like to understand more about where I am right now, my health condition, what my treatment options are, and what's ahead for me. And that has opened the door to a lot of great conversations. You don't have to ask all of these, but people pick and choose depending on where they are. And it has helped people, I think, have really good conversations with folks. And just quickly, in the last minute here, because we want to leave room for questions, we just want to introduce you to the Next Steps Toolkit, which is after that Getting Started Toolkit. This is another one that's online. It works a little differently, right? Now we're going to build on those conversations. And that's how the kit works. We're more in a chronic or serious illness mode. And we really want to be able to know how this works across right to the end of life. So all we're really doing here is building on conversations, adding documents, updating documents, and really working closely with our providers. So in the Honoring Choices online, you'll see we have not only that first conversation guide, but for consumers, we really have another guide that builds on it when you're managing a chronic illness, living with serious illness. We also have a palliative care toolkit because, as Dr. Davila was talking about, it's such an important, wonderful piece of care, palliative care. Not a lot of people know about it or the difference between that and hospice care, how to get that in your communities. That's all on our website. We also just want to mention 2 other conversation guides. This has been wonderful for people with serious illness. We work very closely with partners. Ariadne Labs is a partner. The Conversation Project is a partner. Together, they have this great workbook when you're in that serious illness mode for adults and families to prepare for those conversations before they actually have them. And for care providers, and this is, I promise, we're getting there. Ariadne Labs has a wonderful serious illness conversation guide that works seamlessly with everything I just talked about. You can check that out. So we're adding to the documents. There are more documents. Everything is on the website for you to look at: the Durable Power of Attorney, the MOST form, the CCDNR form. Again, those are medical orders, those last 2 for life-sustaining treatment. Lot to know about there, but lots of fact sheets for you there. And that's it. And we'd like you to just start everything today. Just start with that Getting Started Toolkit. It includes the proxy, the directive, conversation guides, the wallet card, and some fact sheets. And then, and I'm sure that we'll send you some information on the website and how to access it. I'm going to stop here so we have time for questions.
Thank you so much, Ellen. Christine, I think now we can stop the recording and